It's time for the news.
The Algerian Economic Revival Council has installed the National Consultative Council of Exportation Promotion, describing it as a strong impetus between public powers and economic operators. And the Minister of Foreign Affairs and the National Community Abroad, Ahmad Attaf, has affirmed that the recent burnings of the Holy Quran in Sweden and Denmark constitute a blatant provocation of the feelings of Muslims all around the world. And Algeria has reiterated its deep attachment to the return to constitutional order in Niger and its support to Mohamed Bazoum as a legitimate president. And the United States said it was having contact with Niger President Mohamed Bazoum and reiterated its support to the efforts deployed by the Economic Community of West African States. And those were the major developments. Now, the full news edition. Good afternoon. President Abdelmadjid Tebboune has made a reshuffle among the national security services that regarded several directors. And the Algerian Economic Revival Council has installed the National Consultative Council of Exportation Promotion, describing it as a strong impetus between public powers and economic operators. The council was installed by Prime Minister Ayman bin Abdulrahman. He said that the council would pave the way for an environment that boosts non-hydrocarbon exploitation. The members of the Algerian Economic Revival Council also reiterated the will of Algerian economic operators to penetrate foreign markets. The Army Chief of Staff Major General Said Shengriha is on an official visit to the Russian Federation at the invitation of General Choykyo Sergei. The visit comes as part of the reinforcement of cooperation between the National People's Army and the Russian Armed Forces and allows them to discuss issues of common concern. And the Minister of Foreign Affairs and the National Community Abroad, Ahmad Attaf, has affirmed that the recent burnings of the Holy Quran in Sweden and Denmark constitute a blatant provocation of the feelings of Muslims all around the world. In a statement at the 18th extraordinary session of the Council of the Foreign Ministers of the members of the Islamic Cooperation Organization, held via video conference, the Algerian Foreign Minister reiterated Algeria's condemnation of such recurrent attacks under the cover of freedom of expression.
We reiterate our firm condemnation of such actions and behaviors, and we firmly reject their repetitive attempts to find excuses to such blatant violation committed under the cover of freedom of expression.
And Attaf insisted that this issue requires common and firm action of retaliation as it purposefully targets the sacred values of Muslims. He added that the irresponsible freedom of expression is neither a freedom nor a right. It is rather a violation of other people's rights. The fifth session of the Joint Cooperation Commission between Algeria and Tanzania has taken place here in Algiers under the chairmanship of Foreign Minister Ahmad Attaf and his Tanzanian counterpart Stergomena Tax. The Algerian diplomacy chief has reiterated the strong commitment of President Abdelmadjid Tebboune and Tanzania's President Samia Suluhu Hassan to keep enhancing important political and economic reforms that benefit the cooperation linking the two countries. For her part, Tanzania's diplomacy chief hailed the efforts made by the Algerian president to boost cooperation between Algeria and Tanzania, expressing her country's will to keep strengthening bilateral cooperation.
I wish to express our sincere gratitude to Her Excellency Dr. Samia Suluhu Hassan and His Excellency Abdelmadjid Tebboune for their leadership and the deliberate efforts to cement the bonds of friendship and the brotherhoods between our two countries. And I believe that's why we are meeting here today, to ensure that we take our partnership, brotherhood to a next level. As we progress, let us continue using the Joint Permanent Commission as a vehicle to strengthen bilateral relations across sectors. We must leverage our respective strengths and the resources to unlock the potential of our economies, enhance prosperity, and contribute to security and well-being of our citizens.
And earlier, the two officials discussed the crisis in Niger and the latest developments in Libya, Mali, and the Sahel, in addition to the Western Sahara issue. Discussions also tackled the repercussions of the Russia-Ukraine crisis on Africa, notably in terms of food and energy security in African countries. Algeria has reiterated its deep attachment to the return to constitutional order in Niger and its support to Mohamed Bazoum as a legitimate president, while warning against foreign military interventions. Algeria expressed support for the return of constitutional order and the respect of the requirements of the state of law, adding that constitutional order must be through peaceful means that make Niger and the region's countries avoid insecurity and instability. And meanwhile, the Minister of Foreign Affairs offered his condolences to the Republic of Pakistan following the terrorist attack that killed more than 40 people. The United States said it was having contacts with Niger President Mohamed Bazoum and reiterated its support to the efforts deployed by the Economic Community of West African States to secure restoration of the constitutional order. The U.S. State Department said the U.S. objective is to support the West African Organization states' efforts to convince the military in Niger to reconsider their attempt to seize power and to reinstate the democratic order there. It stressed that the pressure of the U.S. diplomats and military would be determined in the forthcoming days in case all efforts failed to achieve progress. This came as France said it was preparing to evacuate its nationals from Niger on account of the worsening of the situation in the country. A similar move has been announced by Italy at a time when Germany advised its nationals to leave Niger. Meanwhile, the deputy head of the Italian Council and Foreign Minister Antonio Tajani pointed out that priority should be given to a diplomatic solution to the crisis in Niger. He said that he advocated diplomatic settlement to the crisis. (14 hours 39 minutes) Algiers time. You're still listening to Radio Algeria International. In Sudan, fighting has continued between the government and the rapid support paramilitary forces in several residential districts in Khartoum. According to media, the fighting, considered the most violent, was raging in the capital's southern part, notably west of military base. The clashes have raged for over 3 months amid the lack of progress achieved by the two sides as part of peace negotiations held in Saudi Arabia. And the special representative of the UN Secretary General for Libya, Abdoulaye Bathily, has affirmed that the elections remain the only means of building up a new Libya. In a statement made during a meeting of dignitaries held in Tripoli, he stressed that the UN mission was helping the Libyans to find a solution to the political deadlock. The UN envoy stated that stability would prevail in Libya once a new government was elected and called on the regional and international partners to back the UN mission to Libya to fulfill its mission aimed at restoring peace and stability in the country. You're still listening to Radio Algeria International, 14 hours 40 minutes Algiers time, and time now for the headlines. The Algerian Economic Revival Council has installed the National Consultative Council of Exploitation Promotion, describing it as a strong impetus between public powers and economic operators. And the Minister of Foreign Affairs and the National Community Abroad, Ahmad Attaf, has affirmed that the recent burnings of the Holy Quran in Sweden and Denmark constitute a blatant provocation of the feelings of Muslims all around the world. And Algeria has reiterated its deep attachment to the return to constitutional order in Niger and its support to Mohamed Bazoum as legitimate president, while warning against foreign military interventions. And the United States said it was having contacts with Niger President Mohamed Bazoum and reiterated its support to the efforts deployed by the Economic Community of West African States to secure a restoration of constitutional order. You're still listening to Radio Algeria International, 14 hours 42 minutes, Algiers time, and I invite you now to listen to Health Magazine presented by Mohamed Khatel.
Hello and welcome to this new edition of your weekly program, The Health Magazine. Every year, World Lung Cancer Day is celebrated on August 1st to create awareness and educate people worldwide about the concerning issues of lung cancer and raise the urge to focus more on lung cancer research and arrange financial and moral support for it. Lung cancer is one of the most common cancers in the world, which accounts for a large number of patient mortality worldwide, representing 20% of total cancer mortality. It is also one of the common cancers in the male population in developing countries. It is a type of cancer that begins in the lungs and most often occurs in people who smoke, both in smokers and in people exposed to secondhand smoke, even though lung cancer can also occur in people who have never smoked. Lung cancer often doesn't cause signs and symptoms in its early stages. Lung cancer signs and symptoms typically occur when the disease is advanced stage. This year, World Lung Cancer Day message also wants to magnify how research breakthroughs have made living with lung cancer as a managed disease a reality for many patients. How does lung cancer occur? Lung cancer occurs when cells in the lungs grow in an uncontrolled way. The cancer may start to grow in the lungs or may spread to the lungs from a cancer somewhere else in the body, secondary cancer, or metastasis. Lung cancer is the fifth most common cancer in the world in general. It spreads quite quickly. This cancer is diagnosed more often in older people, and it is much more common in smokers, although non-smokers can get it too. Lung cancer is generally divided into two main types. Non-small cell lung cancer makes up about 85% of lung cancers. Small cell lung cancer makes up the remaining 15% of lung cancers. Small cell lung cancer usually starts in the middle part of the lungs and tends to spread more quickly than non-small cell lung cancer. What are the symptoms of lung cancer? Common symptoms of lung cancer include a persistent new cough lasts more than 3 weeks, a change in the cough you've had for a long time, breathlessness, chest or shoulder pain, a chest infection that does not go away or keep coming back, coughing or spitting up blood. Other symptoms may include fatigue, unintentional weight loss, difficulty swallowing, and hoarse voice. Having some of these symptoms does not mean that you necessarily have lung cancer. Many of these symptoms can happen because of other medical problems or smoking. However, if you notice one or more of these symptoms for more than a couple of weeks, you should see your doctor to discuss them. What causes lung cancer? Cancers are usually caused by genetic changes, mutations, in your body's cells. There are many factors that increase your risk of developing cancer, including the following. Old age, living longer, means your body's cell may have undergone more mutations, which means you may be more likely to develop cancer than younger people. Smoking. Smoking damages the cells in your lungs and increases the chance of them undergoing mutations. Smoking is a major risk factor for developing lung cancer. Passive smoking, which is exposure to secondhand smoke in your environment, also increases your risk of developing lung cancer. Family history. Some genetic mutations that may cause cancer can be passed from parents to child. If you have a family history of lung cancer, you may be at a higher risk of developing lung cancer yourself. Exposure to certain elements, significant exposure to substances such as asbestos, radon, and some heavy metals may increase your risk of developing lung cancer. Lung diseases, you may have a higher chance of developing lung cancer if you already have a lung disease such as pulmonary fibrosis, pulmonary tuberculosis, or chronic obstructive pulmonary disease. When should I see my doctor? You should see your doctor right away if you have new symptoms that concern you, especially those listed above. This is particularly important if you have risk factors for lung cancer, such as a history of lung disease, a family history of lung cancer, or you are a smoker. How is lung cancer diagnosed? Lung cancer is diagnosed with a range of tests and scans. When you visit your doctor, they may ask you questions about your general health and medical and family history. They may also perform a physical examination. They may then refer you for blood tests and/or scans. You may have blood tests to find out your general state of health and how well your kidneys and liver are functioning. You may have scans, such as X-rays and computerized tomography scans, to look inside your body for signs of cancer. You may also have tests to determine how well your lungs are functioning. If your doctor is concerned about any finding that these tests show, they may refer you to a specialist doctor for more tests. These can include more scans, such as positron emission tomography scans, or procedures such as a bronchoscopy involves looking into your trachea and the large airways of your lungs for abnormalities. It is performed by a specialist doctor, usually as a day procedure under sedation or a light general anesthetic. This means you will be asleep during the procedure and you will not feel it. You may have a sore throat and/or cough up some blood after the procedure, but most people recover quickly. During a bronchoscopy, a sample of lung cells, biopsy, can be taken to check it for signs of cancer. If your doctor does not recommend a bronchoscopy, you may need to have a surgical procedure to obtain a biopsy. Biopsies are collected and analyzed by experienced specialist technicians and doctors and are usually very accurate. If you are concerned about this procedure, you may wish to discuss this with your doctor. You may also be asked to provide a sample of sputum or have fluid drained from around your lungs to look for cancer cells. If you are diagnosed with lung cancer, your tests and scans will give your medical team important information about your cancer and help them decide the best way to treat it. This usually involves a process called staging, where the cancer is categorized based on how big it is and how far it has spread. How is lung cancer treated? Medical specialists can treat lung cancer in different ways. The type of treatment a medical team recommends for you will depend on several factors, including the type of cancer, its stage, your general health, and the goal of treatment. The most suitable treatment will also depend on whether the cancer started in your lung, primary, or spread from another part of your body, metastasis. In the case of a metastasis to the lung, the treatment is usually chosen based on the location of the primary cancer. Types of cancer treatments can include surgery to cut out the cancer. This includes a lobectomy, where one lobe of a lung is removed, a pneumonectomy, where one whole lung is removed, or a wedge section, where only part of the lung is removed. Radiotherapy, which damages cancer cells and stops them dividing or spreading. Chemotherapy, which uses strong medicines to kill cancer cells. Targeted therapy, which uses medicine that attacks specific features of a cancer, for example, certain genetic mutations. Immunotherapy, which helps your immune system see cancer cells and kill them. Your medical team may recommend one or a combination of these treatments depending on your situation. Cancer treatment may be given with the aim of removing all signs of cancer, curative. In other cases, the goal may be to relieve symptoms and maximize quality of life. Palliative care, without necessarily curing the cancer completely. The prognosis of lung cancer depends on how advanced it was at diagnosis, staging, the effectiveness of cancer treatment, and a person's general health. Your doctor can discuss realistic expectations for your own prognosis. Together, you and your medical team can create a cancer treatment plan that contains the goal of your cancer treatment and the steps that these involve. Now, can lung cancer be prevented? You can reduce your risk of developing lung cancer by avoiding known risk factors such as smoking and asbestos. Other risk factors such as age and a family history of lung cancer cannot be changed. What are the complications of lung cancer? Some people with lung cancer will develop symptoms such as shortness of breath, a cough, and/or chest pain because of how the cancer affects the lungs' function. As it advances, lung cancer may cause other complications. These can include fluid buildup in the space around your lung. Lung cancer can also affect your appetite and you may lose weight. You may feel very fatigued and/or have difficulty sleeping. You may also experience these symptoms and others as side effect of lung cancer treatment. Your medical team has a lot of experience in treating symptoms and complications of lung cancer and can give you advice and support to manage them. Even if you are receiving cancer treatment, there is still a chance that your cancer can spread to another part of your body. If this happens, you and your medical team may adjust your cancer treatment plan. And with this, we come to the end of this edition of your weekly program, The Health Magazine. Don't forget to join us next week with a new topic and new recommendations for your well-being and the well-being of your family and friends.
(14 hours 42 minutes) Algiers time. That was our health magazine presented by Mohammed Khatel, and which was dedicated this week to lung cancer